So for this video, we'll be talking about infection prevention and control and its importance for healthcare workers. So some key points, a primer on infection, its sources, and how it is spread, and then what is infection prevention and control, and the basics of IPC and some precautions regarding IPC. So first, what is infection? Infection occurs when viruses, bacteria, or other microbes enter the body and begin to multiply. This leads to disease, which occurs when the cells in our body are damaged as a result of infection. And there are five major categories of microbes or infectious agents. Next is how are infections spread? There are three ways. Um, so through the source, which is an infectious agent or germ that refers to the virus or bacteria or other microbe. Sources are where these germs live, such as sinks, surfaces, or even skin. Another is the susceptible person, someone who is not vaccinated or otherwise immune, or someone who has a weakened immune system. Another way of how infections spread are through transmission, which refers to the way germs move to susceptible people. Germs depend on people, the environment, and/or medical equipment to move in healthcare settings. So, what is infection prevention and control, or IPC? It is a practical, evidence-based approach preventing patients and health workers from being harmed by avoidable infections. So, for example, this includes the use of PPE, hand hygiene, and disinfection. So, IPC is one of the terms used by the CDC and the WHO regarding infection prevention and control. So, anything regarding uh, controlling infection. So, IPC is unique in the field of patient safety and quality of care. It is universally relevant to every health worker and patient at every healthcare interaction. Without effective IPC, it is impossible to achieve quality healthcare delivery. So, infection prevention and control affects all aspects of healthcare, including hand hygiene, surgical site infections, and how hospitals operate during and outside emergencies. So, effective IPC requires constant action at all levels of the health system, from top down. So, what are some infection prevention and control basics? So, first is the standard precautions for all patient care. So, this is based on risk assessment, use of common sense, and PPE use. It protects healthcare providers from infection and prevents the spread of infection from among patients or clients. So, first and foremost is performing hand hygiene. This prevents the spread of germs, including those that are resistant to antibiotics. Next is the use of PPEs whenever there is an expectation of possible exposure to infectious material. Next is covering your cough. We always follow respiratory hygiene or cough etiquette principles. So there is coughing to your elbow or coughing inside your shirt. The next is ensuring appropriate patient placement. Always include the potential for transmission of infectious agents in patient placement decisions. So, in a few slides, we will talk about the transmission-based precautions. So next, we have disinfect and sterilize. We should always properly handle, properly clean, disinfect patient care equipment and instruments or devices. Next, we have handling laundry carefully. Laundry and bedding are important parts of environmental infection control, so this is also applied for disinfection. The first um, square on our left, this is also related to environment control. The next is injection safety, so always follow safe injection practices. Next is occupational IPC. Always ensure healthcare worker safety. This includes proper handling of needles and other sharps. And the next we have our IPC basics. We have transmission-based precautions. These are additional precautions used on top of the standard precautions. So first of our transmission-based precautions, we have contact precautions. These are for infections that represent an increased risk for contact transmission. So since the transmission-based precautions are used on top of the standard, there are some precautions that are also applicable in these in the transmission base that are derived from the standard. So first we have ensuring appropriate patient placement, using PPE appropriately, and now we have limiting transport or movement of patients. So when transport or movement is necessary, we cover or contain the infected or colonized areas of the patient's body. Next, we have use disposable or dedicated patient care equipment. So if common use of equipment for multiple patients is unavoidable, we clean and disinfect such equipment before use on another patient. So for example, the cuff of the blood pressure monitor or the diaphragm of your stethoscope. So before you use it on a different patient, you disinfect it every time. The next is prioritize cleaning and disinfection of the room. So again, this is for environmental infection control. The next we have our droplet precautions. This is for those infected with pathogens transmitted by respiratory droplets generated by coughing or sneezing or talking. So first we have source control. We put masks on the patient, and then again we have ensuring appropriate patient placement, using PPE appropriately, limiting transport or movement of patients, um, and now we have airborne precautions. So the airborne precautions are those for those with pathogens transmitted through the airborne routes. So for example, tuberculosis, measles, chickenpox, disseminated herpes zoster. So again, we have source control, we have ensuring proper patient placement, and then we have restricting access of susceptible healthcare personnel if other immune healthcare personnel are available. So we restrict the access of susceptible um, healthcare personnel from the patients who are at risk of pathogens with the airborne route. So next we have using PPE appropriately, we have limiting patient movement, and then we also have immunizing susceptible people as soon as possible following unprotected contact for vaccine preventable infections such as measles, varicella, or smallpox. So next we have some example signs of the contact precautions. So here we have hand hygiene, we have using PPE and also using dedicated equipment and disinfecting them after every use. Next, we have the example sign for droplet precautions. We have hand hygiene and using PPE. Next, we have airborne precautions. We have hand hygiene using high-level respirators, since airborne precautions are usually through the airborne route, so through sneezing, talking, coughing, and then included in the environmental control, so doors to rooms must remain closed. So what are the takeaways from this video? So first we have infection control aims to prevent pathogens from coming into contact with a person in the first place. So infection prevention, if we can prevent it, then we do the precautions needed before we get infected. And if we do get infected, we have infection control. So that's why it's infection prevention and control. Next, we have basic infection control procedures include hand washing and keeping the environmental, so say the hospital system or the hospital environment clean. So the pillar of infection control is hand washing. The last is finally the basis of good infection control in the environment of the of healthcare, where healthcare takes place, is to assume that everyone is potentially infectious. Proper procedures have to be followed at all times. And that is all. Thank you very much for listening.